Also, do cell phones cause cancer?
We need to know that much more about long-term use.
The largest study of its kind. Dr. Rhonda Lowe rings in with her diagnosis. The debate over whether there's a link between cell phones and brain cancer is heating up. A long-anticipated study has been released, and while it appears to answer some of the controversial questions surrounding cell phone safety, it doesn't look like it will be the final word on the subject. CTV's health specialist, Dr. Rhonda Lowe, reports.
It's the largest study of its kind, looking at a much-loved device. 13 research teams across the globe working to answer the question, do cell phones increase your risk of brain cancer? And the results are somewhat encouraging.
Overall, we don't see an increased risk, so that's comforting from the public health point of view.
The study followed 10,000 people for more than a decade. When it comes to casual users, it found no increased risk in two types of brain tumors.
It says we don't have an epidemic of brain cancer related to mobile phone use on our hands.
But there was troubling data involving people who use their cell phones for more than half an hour a day. These so-called heavy users had a 40 to 80% higher risk of a deadly form of brain cancer.
So if there's a risk, that's where we would expect to see it. So to me, this is an interesting finding that tells me that maybe there is something going on.
Still, the researchers say further investigation is needed. The study did not include children, and cell phone technology and the amount of time we use them have changed dramatically from a decade ago. All factors that could impact future research.
I don't think this is the definitive study or the last word, and we need to know that much more about long-term use.
For now, public health experts say the recommendations remain unchanged. Cell phones are safe for adults. But for those looking to reduce electromagnetic radiation, hands-free devices and texting are always a good option. Now, the good news is, since the study was conducted, the design of cell phones has improved, producing fewer radio frequency emissions. But the bad news is, more people, especially children, are now using the phones for much longer than before.
So where do we go from here, and what do you tell your patients?
You know, Bill, many experts disagree with the findings in this study, saying the research methods were really flawed. And at best, I think we can say that these results are inconclusive. That's why there are more studies underway using newer cell phone technology and following 250,000 people as time goes on. There's also another international study looking at the risk of brain tumors from cell phone use in children and teens. Meanwhile, if in doubt, I always tell my patients to use a hands-free device and limit the amount of time your child spends on a cell phone.
Thank you, Doctor.